Welcome to this webinar on health literacy and patient information as part of our series on the Knowledge for Healthcare strategy. My name is Ruth Carlisle. I'm Head of Knowledge and Library Services across the Midlands, East and North of England, and it is my pleasure to co-lead our work on health literacy and patient information with my colleague Sue Robertson. In terms of the session that we're about to go through now, we're actually going to talk about the scale of the challenge, what it is that we're actually wanting to address as a strategy, what strategic approach we're taking, and then looking at tips and techniques in terms of health literacy and patient information, some of which will be familiar to some of you, but at least one of which will not be familiar to any of you. So what is the scale of the challenge? If we're going to have a strategy, we need to know what it is that we're trying to confront and what it is that we're facing. Well, at a national level, we start with the issues in terms of a literacy challenge. Who is able to read? Who can actually pick up a piece of information in an unfamiliar context and feel confident to be able to read it? So we know that in England, 1 in 6 adults struggle with literacy. We know that 16% of adults, or 7.1 million people, have what's described as very poor literacy. So these are people who, if they receive a piece of information and it's in an unfamiliar subject, then they will struggle to be able to read it. We then have issues not just in relation to the literacy, but also the information literacy. Can you find information? Can you assess it? Do you really know what it is that's reliable and how it is that you might be able to work with it? So we have words, the literacy challenge, and we have the finding information, the assessing information. But what also about the digital era? Digital skills are increasingly important for health information. We know that with the pandemic, many charities have had to stop their print production, moving purely to online information materials. The NHS itself has a digital-first approach and therefore is increasingly moving to online communication, online mechanisms in terms of management of health. But alongside that, people struggle in terms of their digital skills. We know from work done by the Lloyds Banking Group that 9 million people in the UK cannot use the internet without help. Studies looking at 5 core digital skills, such as the ability to be able to attach a document to an email, show that 52% of adults of working age do not have all 5 of the core skills to be able to work in a digital environment. 6 million people cannot turn on a digital device. Now, this has significant issues of itself, but when you put it alongside the issues in terms of literacy, it means that we have a challenge which involves both using the words and the technology for it. This brings us then to our health literacy challenge. So, health literacy is a national challenge. It builds on people's literacy, their ability to use words, and their numeracy, their ability to use numbers. If you have information that's purely text-based, so words without numbers, 43% of adults of working age struggle to understand that health information. If you add numbers, 61% struggle. Now, let's think about that. Most health information combines words and numbers. Just think about dosage information, the number of tablets people need to take, or information in relation to frequency of exercise, for example. Unless people understand the numbers as well as the words, it's very hard for them to be able to take informed decisions about their health. We also have the complication that at the point of shock, such as when somebody's had a diagnosis, the health literacy level for all of us goes down. So however well you may be able to manage in normal circumstances, if you're facing a health challenge of some sort, actually your health literacy will go right down. So these are the numbers at a national level, the 43% where it's just words, and 61% struggling when it's words and numbers. What does that look like locally? So we commissioned the University of Southampton to look at what this means at a local level in terms of the challenge for health literacy. And so we have data based on numeracy and literacy that estimates at a borough level what the likely level is for health literacy. So if you think about the best possible scenario, then actually for people struggling both with words and numbers, actually the best place in the country in terms of the highest level of health literacy is actually South Cambridgeshire, where actually just over 46% still struggle, so nearly half still struggling even at the best. Whereas if you're looking at the worst case scenario currently, that's Newham, so nearly 82% of people struggle to be able to understand health information that combines words and numbers. If you want to look up in your own locality what the level of health literacy is, or to compare it with other localities, then if you go to healthliteracy.geodata.uk, you can search either just to see your own locality and then how it compares nationally, or you can go onto a map so you can see how you compare in terms of the neighbouring boroughs. So this is the challenge that is the context for knowledge for healthcare. So knowledge for healthcare has always had an element that's to do with the right knowledge, right evidence at the right time for members of the public and for patients alongside staff. And this is the activity that this patient information and health literacy work involves. When you look in detail at the strategy itself, you will see that actually we have outcomes that relate to healthcare organisations, so assuring that staff and patients can use evidence-based patient information. Those that relate to individual members of healthcare staff, so those staff being able to identify and use high-quality information. We then have information providers and supporting information providers across the system to have health literacy skills and awareness in terms of using evidence-based patient information. And then knowledge and library services, so the role in terms of championing health literacy techniques underpinned by digital skills. The interventions at a local level will vary. For some services, it's about providing access in terms of health literacy training. For some, it will be having supplies of resources in terms of reading well resources, for example. For others, it will be having information clinics where people come in to receive information, or it may be having patient access. These are all valid and useful mechanisms in terms of our health literacy and patient information work, and really do depend upon what your local circumstances are and what it is that you're able to offer. So if we're thinking about health literacy, where does that fit alongside other skills? So we know that knowledge and library services have already been playing a range of different roles in terms of health literacy and patient information, increasing from 27% back in 2014 of services being involved in some form of patient information activity to 78% in 2018. What we're talking about within this strategy builds on that and builds on a range of different skills. So health literacy and numeracy as being the core skills that may not be ones that we get involved in ourselves, or we're dependent upon others within the community to be able to develop. Information literacy and digital navigation, which again will be working with colleagues in different sectors to be able to provide those skills, but enabling them to be aware of health literacy, and building all of these together to become a health context in terms of how it is that you make decisions about health. So how is it that knowledge and library services might get involved? At a local level, many of you are already involved in terms of supporting health and digital literacy, often through partnerships with, for example, public libraries, perhaps with prison librarians, or with school librarians within your locality. To support your work at a local level, we're working nationally in terms of developing tools, so things like our Train the Trainer on health literacy, but also work in terms of partnership development and how it is that we can give national momentum to local activity. By working in partnership, we aim to minimise duplication and to work as effectively as possible across the system. So we're exploring with national partners three core elements in terms of how it is that we work together. So partly around skills, so how it is that we support each other to improve health literacy and digital literacy skills. Then secondly, increasing access to high quality patient health and wellbeing information. And then thirdly, building partnerships that really enables us to develop good practice. So what is it that we aim to achieve through these partnerships? Well, through our partnerships, what we aim to achieve is both intermediate and strategic for the longer term. So in the shorter term, what we aim to achieve is really in terms of how it is that information providers are aware of health literacy as an issue and can use evidence-based sources of patient health and wellbeing information. So good quality signposting alongside how it is that we provide people with skills. But strategically, we want to achieve from this patients and the public being better equipped to find and to use evidence-based patient health and wellbeing information. But also in the longer term, citizens being better equipped so that they can actually use health services when they need to. And we know that partnerships that deliver this sort of activity have been ongoing for some time at a local level. If we look at the case studies that many of you have provided, then we can see examples where local knowledge and library services have already been signposting their colleagues within public libraries to sources of high quality information, and also providing them with training so that they are able to share health literacy skills and techniques with members of the public or with other colleagues with whom they're working. So that's our strategic direction in terms of the activity through Knowledge for Healthcare. I'm now going to share some patient information techniques with you, followed by some health literacy techniques. So starting with our patient information techniques. And these are techniques that you can use yourselves in terms of your own work, but they're also ones that you can share with colleagues working in other sectors or with colleagues within the NHS. So we think about what's legally required around health information, particularly information for patients. Well, since the 1st of August 2016, members of the public who have a particular access need, such as needing information in British Sign Language or Braille, have had a legal right to ask for health information to be provided in that format, to have their preference or their need recorded, to have it flagged with colleagues, and to have it shared with other organisations with their permission. So this gives us a basis from which, because information needs to be provided in different formats, we can help organisations to signpost effectively to what already exists in terms of resources in different formats. So the Accessible Information Standard is a good lever for us and something to be aware of in terms of patient information. So we have content in terms of the format, but what actually about the conversations? So with conversations, it's important that members of the public prepare for good consultations. And perhaps this is particularly important when so many of our consultations are now online and often by telephone. So there is actually very limited opportunity in terms of sharing either a screen or printed information for a conversation. So people need, if they're not sitting in a waiting room and looking at leaflets, they still need to be able to prepare for the core 3 questions. So these are 3 questions that have been based on work by the Health Foundation and others over the last 10 years, but are also likely to appear in the new NICE guidance on shared decision making that's due out in November this year. So the first question is about what are my options? The second, what are the pros and cons of each option for me? And then thirdly, how do I get support to help me to make the decision that's right for me? Now, the wording of these is not particularly user-friendly, so we are working at the moment with people with learning disabilities to help us to think through whether there may be an easy read version of the questions that we can share with knowledge and library specialists be able to use at a local level. So the ask 3 questions, the better preparation and how it is that people work. And then there's assessing information itself. Now, if you're thinking from the perspective of patient information, your prioritisation in terms of how it is you assess the information and what it is that you do first when you're looking at a resource is slightly different from if you're looking at, for example, an academic paper. Because we're looking at information that has to be accessible to the individual, the first thing you look at is the format. And if the format isn't right, then actually it fails at the first bar in terms of elements through. The next point is actually the age. If it's more than 3 years old, then it's likely to be out of date. There will be some things, for example, resources on bereavement, which, unless addresses have changed, will still be fine to use after 3 years. But many resources do date very quickly in terms of patient information. So is it dated, and is it less than 3 years old? The third one is actually independence. Can you tell who wrote or funded it? If you can't tell, actually, can you be sure of the reliability of it? Is there any likely bias? For example, is it funded by a pharmaceutical company, and is that company's product named within it? Then there's the review. How frequently is it reviewed? So does it have a review date, and is it within that date? Most resources need to be reviewed within 3 years because they do go out of date very quickly. So you need to have a review date and to check that it is still within that review date. And then we come to our underlying evidence. Does it quote its source of evidence? So if you like, a fair test in terms of the format, age, independence, review, and evidence when you're looking at patient information to assess that. We then come to health literacy and some of the specific techniques that you can use for health in terms of health literacy support. The first of the tools that we talk through in more detail in our training is teach back. When you're communicating, if you're the person that's sharing information, it is your responsibility to help and support your audience, the person you're sharing information with, to understand that information. Now, a pre-recorded webinar is not an ideal mechanism for me to be able to share information with you. It does mean that you can stop and restart or rerun it if you wish to do so, but actually I have a responsibility to make sure that it's reasonably clear. So hence, for example, appearing on video at the same time as being on these slides, so that those of you who need to lip read may have more of an opportunity to be able to understand it. If you can't understand something, you can't make decisions. So it's a fundamental issue. And therefore, the person who is sharing information needs to get the person who's receiving it to tell them. So ask you, tell me how it is that you've understood it. And it isn't a case of, oh, what did you understand by this? Much more asking a question in the context. So for example, what would you tell your friends about this? How would you prepare? So if it was, for example, something about tablets, how it is that you would organise taking tablets in the day to make sure that you're able to do something correctly, or it might be literally how it is that you would talk to your family about a diagnosis when you've got home. So that's helping people to share their own personal understanding, but also a degree of preparation in terms of their next steps. Then if the individual hasn't understood, it's a case of re-explaining in a way that's supportive to them, and then continuing until both are happy with understanding. Now, this is a technique that you can then share with your clinical colleagues for them to use. You can share it with your colleagues in terms of the public libraries, for example, so that members of the public can prepare and can think about how it is that they might respond to this sort of approach. It may also be something that you can try out with your children or with those around you, because often teaching back is a fair technique. So it's not about you taking on a clinical role, it's about you being able to share a skill with colleagues. And often teach back works best if it's alongside another tool, which is chunk and check. So with chunk and check, it basically means that you have a short piece of information rather than a long piece of information, and then you check after that short piece of information. I think for all of us, information that's in short pieces can be much easier to take in, whereas a long webinar can actually be much more difficult to concentrate on from start to finish. But there are tools and resources to help you with this, and many of you I know will have taken part in some of our training. So we have things like the how-to guide, which we developed with NHS England and Improvement, Public Health England, and the Community Health and Learning Foundation. And this gives you a range of different definitions, general communication tools, verbal communication tools, written communication, so things about style, design, those sorts of things that can help you in terms of advising colleagues or signposting colleagues to the guide itself so that they can make their own decisions. Alongside the how-to guide, there are things like a business case mock-up so that you can actually think about how it is that you might justify having a project around health literacy, training tools and other resources in terms of case studies. So the how-to guide, but we also have e-learning. Our e-learning was developed in collaboration with NHS Education for Scotland, and it's a tool that generally takes people about 35 minutes to complete, although you can go back and do specific sections again if you find that it's useful to do so. It generates an action plan that you can put into your CPD file so that you have a personalised record in terms of, for example, what you might want to do in terms of sharing skills with colleagues, what it is that you might want to do in terms of your own steps and your own learning. So those are the tools and techniques. And I hope that actually that's been helpful to you in terms of getting more of a context around our health literacy and patient information work. If you want to know more about our health literacy and patient information work, do contact us if you'd like that further information. If you'd like to get involved in terms of doing more by way of training, do look out for training opportunities. And if you haven't already had an opportunity to do so, do read the Knowledge for Healthcare strategy itself, and perhaps also look at the Easy Read version as an example of how an Easy Read tool works. Thank you for listening.